News 2 at 4. The types of elective surgeries haven't really changed over the past few years, but how doctors are able to accomplish the results have. Dr. Anthony Stevens joins us now to talk about a no-touch technique, something that you've been using every chance you get, right?
Yes, for some time now, regarding silicone implants. You know, we have a couple of choices these days. Used to, we had only saline, which we rolled up, made a small incision in the breast, either through the axilla or usually underneath the breast, and we placed it in the pocket through a little bitty incision, maybe an inch long. Silicone implants, to put them in, you can imagine trying to put this in through a small, 1-inch incision was a problem. You know, there are a few things out there that have been invented we wish we would have thought about, and this is one of them, called the Keller funnel 2, which allows you to make a very small incision. We take the implant, the nurse usually dumps it into the funnel, like this. And we're able to make that little 1-inch incision and then insert the implant into the breast or behind the muscle. Voila, pretty simple. It allows for a smaller incision, less contamination of the implant. You don't have to touch the implant as much, so that means less contamination and possibly less chance of something called capsular contracture, hardness, firmness around the breast, that accompanies putting it into a small incision. And you don't traumatize the skin edge like you would trying to place this in through a little bitty incision normally.
It also looks like it's way easier than anything else.
And it allows for me, I use a lot of sizers to put in to try different sizes on ladies and sit them up. And this allows you to do that without contaminating the implant, contaminating the pocket, and it allows ease of access. And you can do it through a smaller incision, and you don't traumatize the skin edge. So in the end, the scar looks much better.
Wow. So doctors everywhere, all across the country are using
I think this is becoming more standard as time goes on. The implant, or the manufacturers improved this so that we're now able to put in more what's textured implant, or the gummy bear implant, which is textured, and you almost have to use one of these to put those in because it has a lot of texturization to get it in. So I think you're seeing this used more and more with various incisions, and more physicians are kind of catching on to the idea.
Something that's so simple, too. It really is.
Very, very simple. And the cost of this is not insignificant. As we were talking earlier, they're about $110 a piece for something so simple.
Wow.
But it's well worth it, and I think it benefits the patient greatly every time we use it.
All right. Dr. Anthony Stevens, thank you so much for coming on today. We appreciate it. You're watching WBR News 2 at 4. We'll be right back.
The incredible rooms to go.